Hello everyone, my name is Dr. Kathrin Rac and I'm a GP trainee. I have previously worked within ophthalmology as a registrar for many years, most recently at Westmead Hospital in New South Wales. In this Facebook Live session, we will discuss the pros and cons of public versus private care for your glaucoma management and treatment. We will leave live questions until the end, and hopefully some questions will be answered during this presentation. I will also address commonly asked questions. So, which best suits you, public or private? So choosing public or private care depends entirely on your preference and personal circumstances. There are a number of factors to consider. This includes your financial means, convenience, ease of access, location or personal choice of specialist, among others. There is a common misconception in society that private care delivers superior care. However, public eye clinics can offer just as good a service, but there are some factors which we will look at that may be preferred by the patient in private care. There are new emerging models of care in the public health system, which I will further discuss, that improve patient satisfaction and are aimed at reducing public hospital wait times. So let's now look at some of the pros and cons of private versus public care. Private care is covered by your private health insurance, but can still involve out-of-pocket or gap fees, whereas public care is entirely funded by Medicare. The gap amount in private is dependent on specialist fees, as well as anaesthetist and theatre costs if having surgery. A patient can still access private health care if they have no private insurance, but there will be higher out-of-pocket costs. There are, however, overall shorter wait times in private care, which includes both waiting for an appointment and the in-clinic wait time. Public eye clinics have a higher volume of patients per clinic, which can also include emergency patients that need to be seen before patients with scheduled appointments. In private care, you can also choose which specialist you would prefer to see. Whereas in the public system, you will also be reviewed by junior doctors and training registrars who are supported by more senior clinicians or consultant specialists. Not all hospitals have eye clinics, and therefore you may need to travel some distance to the nearest hospital with an eye clinic. There may be private eye clinics closer to you, which you may choose to access for convenience of location. Public eye clinics with certain subspecialties such as glaucoma may also not run daily, therefore there would be limited choice to which day and time you can have your appointment, which may not necessarily be suitable or convenient for you. If an eye condition is associated with other systemic conditions, then referrals may need to be made to other specialists in other locations, whereas in public eye clinics, referrals can be made in-house, potentially reducing the inconvenience of traveling to multiple sites. There was a recent article published in the Clinical Experimental Ophthalmology Journal by Dr. Thomas Liu and colleagues, which looked at factors which influenced patients to choose private or public care for their glaucoma management and treatment. This study recruited a total of 98 patients with glaucoma or suspected glaucoma from 1 public and 2 private clinics in Sydney. Results determined the main factors which influenced choice, which included the level of clinical expertise of the clinician, being able to see the same doctor every visit, out-of-pocket costs, and wait times. Private glaucoma patients were willing to pay out-of-pocket expenses for clinical expertise and continuity of care. So patients are able to see the one specialist every appointment and build a rapport or relationship with the one doctor. As previously mentioned, you are more than likely to not see the same doctor or specialist in a public outpatient clinic with each appointment. However, your clinical notes are accessible and your management plans and all of your results are freely available to be viewed by whichever doctor is looking after you that day. So this does allow some continuity of care, but you are less able to develop that rapport with the one doctor. As mentioned, to reduce public hospital wait times, integrated models have been introduced at 2 public hospitals in Western Sydney, New South Wales. The community eye care model of care is a service delivery model for patients at risk of developing glaucoma or diabetic retinopathy. It involves a collaboration with local optometrists, general practitioners, and public outpatient eye clinics. Referrals received at the eye clinic are streamlined, and patients who require more urgent care are identified earlier for intervention, and those who do not require very urgent care are referred to the CIC clinics in the local communities until and if a need arises to be seen by the specialist at the hospital eye clinic. I'll just have a look at some of the questions that are coming through. Just give me a moment. So the first question, I'll just answer these two now before I move on. The first question is, would my ophthalmologist get offended if I request to be transferred to the public eye clinic due to financial issues? Your ophthalmologist would not get offended at all. Ophthalmologists and all clinicians are very understanding of personal circumstances. If you just let your ophthalmologist know what the issues are and that you would prefer to go into the public system, then they will help you to transfer care. The next question is, if I change to a private ophthalmologist from the public clinic, how will my new eye specialist obtain my past clinical notes? So if you decide to go private, then the public eye clinic department will transfer over any notes or any results that they have to your private ophthalmologist. This can be done via fax or email, but would require some sort of written consent by you. So you would have to provide consent for that to happen. Now, this sometimes can take a little bit of time. An alternative is for you to request a copy directly and take that with you to, whether you choose to go private or public and have your records with you. That does save some time. Okay, so that's all the live questions for now. So we'll continue on with the presentation. So this is a flow chart which shows the patient's journey from referral to seeing an eye specialist or being reviewed at the CIC clinic. So we can see here that the patient presents to the GP or optometrist for an eye referral. which is sent to the outpatient clinic. The referral is triaged, and those patients that are suitable for the CIC clinic are referred there and assessed by the optometrist. Findings are reviewed remotely by the eye specialist to confirm the diagnosis of glaucoma and diabetes and either continue management at the CIC clinic or are referred to the hospital eye outpatient clinic if required. The CIC clinics screen for diabetes and glaucoma, just as would occur in the hospital outpatient eye clinics by optometrists that are working in collaboration with the hospital specialists. Chronic stable glaucoma or stable diabetic retinopathy patients are also referred to the CIC clinic for ongoing follow-up from hospital outpatient eye clinics to allow for more urgent patients to receive treatment and care where possible. So I don't think any of my slides were seen. If you just want to, I'll just maybe recap a little bit. If you just want to have a look at this table with the private versus public pros and cons, which we've covered, and just wanted to go to the flow chart here, which goes through the patient journey, which I've discussed from referral to either going to a CIC clinic or the public hospital clinic. So now I'd like to take some time to discuss commonly asked questions. So many have asked, why is there such a long wait list to see a specialist in the public outpatient clinic? There is a wait list for public outpatient clinics as there is increasing demand with population increase and aging. Not all public hospitals service specialist eye clinics, and many rural and outer metropolitan areas also rely on these services, which also contribute to the increased demand. There is a need for increasing the available workforce to meet these demands and outsourcing care where possible. So what should you do while waiting for an appointment to the eye clinic? So you can continue to have regular eye reviews with your local optometrist to ensure that there has been no significant deterioration or vision-threatening concerns. If there is any deterioration or concerns by your optometrist, they will contact the hospital eye registrar directly and refer them for an urgent review in the eye clinic. You may also be referred to a private ophthalmologist to initiate care if required, depending on the distance required to travel to the hospital, but there may be out-of-pocket costs with this. So how long are waiting lists? How long you wait depends on the severity of your eye condition. If your eye condition is stable or not vision-threatening, then wait times could be up to 2 years for an outpatient eye appointment. If your eye condition has been reviewed by your optometrist and is found to be impacting on your quality of life, but is not vision-threatening, then you could be waiting a few months. Again, if your eye condition is acute and vision or eye-threatening, then you would likely be seen that day. So it all depends on the severity and type of eye condition that arises. So is it better to see the private ophthalmologist, and is equipment better in private eye clinics? Seeing a private ophthalmologist would allow for earlier review and management of your eye condition, and there is similar equipment for diagnosis and review of your glaucoma in both private and public eye clinics. Public eye clinics have all the necessary equipment to diagnose and manage glaucoma, but not all emerging technologies or all types of glaucoma surgeries may be the standard of care or available in the public system. Some patients may need to be referred to other public hospitals with certain subspecialties to receive specific treatments. So I am worried that I am seeing a trainee doctor at the public hospital. Should I be worried? So patients often expect to see the specialist or consultant at the outpatient eye clinic, but this is not always possible due to the high volume of patients waiting to be seen per clinic. Training registrars will often review patients initially and are well supported by specialist consultants. Training registrars always work in collaboration with colleagues to ensure effective management plans and follow-up of each patient. Patients that are identified to be complex and requiring urgent surgical interventions are always reviewed by specialist consultants. So you shouldn't be worried about seeing a training registrar, as they are well supported and trained. I'll just go to a live question that has come through. So does the waiting list period on a public hospital depend on the location or state? So that was one from previous. So the triage categories usually don't vary state to state. And so referrals would be triaged based on urgency. And they are pretty uniform. So if something is serious, acute, or vision threatening, then the wait list would not be different in different states. The next question is, can we please go through the slide for advantages and disadvantages again? Yes. I might actually just finish these common questions, and then I'll go back to that slide where we discussed pros and cons. So just the second question here, can my optometrist start my glaucoma treatment while I am on the waiting list? So yes, optometrists can initiate glaucoma treatment if the condition is diagnosed early and is stable, but some eye conditions may require review first by a specialist before starting on treatment. And lastly, if you see your private ophthalmologist, can you have eye surgery in the public hospital? You can choose to be treated as a private patient in a public hospital, which would allow your chosen specialist to perform your surgery and may reduce some costs to you. Similarly, to reduce public hospital wait times, some surgeries can be outsourced to private hospitals and are funded by Medicare. However, this usually does not include glaucoma surgeries. This occurs more commonly for patients requiring cataract surgeries due to greater availability of surgeons who can perform this procedure compared to glaucoma surgery, as well as a great number of patients requiring cataract surgery in the general population. So I'll go back to the table. Okay, and we'll just go through that one again. So if we look at the private, so private care is covered by your private insurance, but there may be some out-of-pocket gaps, whereas public is entirely funded by Medicare. Overall, there are shorter wait periods in private care. This includes waiting for an appointment and in-clinic wait times. You have a choice of your specialist, so if you have a preference of who you want to see, you can see that person in private, but in public, this will more than likely not be the case. Private clinics, there are more private clinics and communities compared to public hospital eye clinics. So just for ease of convenience of location, seeing a private ophthalmologist might be more suitable for you. There is generally a greater flexibility in appointment times, as you can see the private ophthalmologist many times a week, whereas in a public system, glaucoma clinics may run once a week or maybe once every fortnight. So it all depends on the location and the hospital. These can run more frequently or less frequently. So you might not get an option as to which day you can go and see the specialist at the public eye clinic. And lastly, we spoke about if you have a more complex eye condition that requires other specialists such as rheumatologists or hematologists to review you, then a private ophthalmologist might need to refer you to other locations to see these specialists, whereas in a hospital we have all the specialties under one roof, and therefore it'd be easier and more convenient to see everyone in the one location. I hope that covered the pros and cons. Were there any other questions at all from the audience? Okay, so I hope all your questions have been answered with this presentation and that it has been helpful. Thank you for joining me today, and I hope you enjoy the rest of Glaucoma Week. Oh, sorry, one other question has come through. Is it better to get a referral to the hospital eye clinic from my GP or optometrist? So the quality of the referral that is sent to the eye clinic can impact on how quickly you are seen. Seeing an optometrist would allow more thorough examination with certain eye equipment that would help your eye problem to be triaged more accurately when it does get to the eye clinic. For example, an optometrist can do a thorough vision check, an eye pressure check, can do OCT imaging, which I think was covered in a previous session. You can have visual fields done, and all these results can be forwarded on in your referral. So it gives a little bit more detail to help triage your referral better. GPs can give a referral, but often they don't have the necessary equipment to add these extra details that can sometimes be helpful when triaging a referral. Okay, I think that's all. Great, thank you everyone.